Okay, Chapter 5 Medical Practitioners 1 Exercise 5.1 Write sentences to describe the work of the specialist in each branch of medicine. Look at B opposite to help you. Number 1 Dermatology. A dermatologist specializes in disease of the skin. Number 2 Rheumatology. The rheumatologist is the medical specialist in the diagnosis of musculoskeletal disease. Number 3, traumatology. A traumatology specializes in the treatment of injuries. Number 4, pediatrist. A pediatrician specializes in disease and the treatment of children. Number 5, obstetrist. Obstetrician specializes women's care during pregnancy and childbirth. 5.2 Complete the table with words in A, B, and C opposite and relate forms. Put a stress mark in front of the stress wordplay in each word. The first one has been done for you. Verb, noun, person, noun, activity or thing. Specialize, specialist, specialty. Practice, practitioner, practice. Consult, consultant, consultation. Assist, assistant, assistance. Graduate, graduate, graduation. Qualify, qualification. Exercise 5.3 Find prepositions and see opposite that can be used to mark word combination with the words in the box. Then use the correct forms of the words to complete the sentences. Number 1, a pathologist specializes in diagnosing disease through examining cells and tissues. Number 2, a pediatrician must enjoy working with children. Number 3, an oncologist is in is interesting is interested in the diagnosis and treatment of cancer. Number 4, a psychiatrist must be good at counseling. Number 5, a neurosurgeon must be good with her hands. Exercise 5.4 Make word combinations using a, a word form each box. Two words can be used twice. Look at A, B, and C opposite to help you. Consulting rooms, general practitioner, group practice, health center, internal medicine, surgical specialties, surgical specialties. Chapter 6 Medical Practitioners 2 Exercise 6.1 Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Associate specialist, house officer, on call, provisional diagnosis, provisional diagnosis, radio pager, wire around. Exercise 6.2 Mark the descriptions with the job titles. Look at A and B opposite to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to ward 60. Letter C, consultant. Number 2, Dr. Stewart has just started the second year of her foundation program. Letter D, ASHO. Number 3, Dr. Singh has started his training as a surgeon. Letter A, specialist registrant. Number 4, Dr. Phillips has just graduated and is working in a large hospital in Birmingham. Letter E, PRHO or house officer. Number 5, Dr. Miller is in charge of the medical staff in the Birmingham Hospital. Letter B, medical director. Director. Exercise 6.3 are the following statements true or false? Find reasons for your answers in A, B, and C opposite. Number 1, a medical graduate becomes registered 2 years 2 years after graduation. False. Number 2, the system of training doctors in Britain is called the Foundation Program. True. Number 3, the same senior house officer is no longer used in Britain. False. Number 4, the consultant is usually the first doctor to see new patients. False. Number 5, when working in shift, all doctors take turns to be on call. False. Exercise 6.4, complete the text of a PRHO describing her job. Look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me he tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves take and story. On Tuesday and Friday morning, the consultant does her, her work around, and I have to make sure up completely up to date on her patients. After that, there are usually lots of things to do, like reading up request form for blood are to be discharged the next day. Discharged the next day. There's usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. Chapter 7, Nurses. Exercise 7.1. Complete the sentences. Look at A, B, and C opposite to help you. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurses is a clinical support worker. Number three, someone who is not qualified but is able to assist nurses is a nursing auxiliary. Number four, a nurse who has qualified is a staff nurse. Number five, a nurse who specializes in health promotion is a visitor. Visitor. Health visitor. Number six, a nurse who looks after a ward is a change nurse. Number seven, a nurse who works in the community is a district nurse. Number eight, someone who answers the ward telephone is a ward clerk. Exercise 7.2. Make word combinations using a word or phrase from each box. Look at the opposite to help you. Carry out a procedure. Change a dressing. Check the temperature. Give an injection. Remove sutures. Exercise 7.3. Complete the sentences with the correct grammatical form of perform. Number one, an isotope brain scan is painless and easy to perform. Number two, biopsy of the pancreas of performed last March. Number three, if the patient's condition deteriorates, a laparoscopy should be performed. Number four, if a diagnosis of meningitis is suspended, a lumbar puncture must be performed. Number five, last year we performed a randomized double-blind group study. Exercise 7.4. Complete the sentences with the correct grammatical form of carry out. Number one, I now intend to carry out a large study. Number two, unfortunately, few properly controlled trials have been carried out so far. Number three, a number of studies have been carried out recently to look at this question. Number four, a right hemicolectomy, was carried out and the patient made a full recovery. Number five, this procedure can be carried out in the emergency department.